What's up, everybody? You are listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker, and Dr. Tyler Betteridge, one of our two sports residents, is here with us today to go through a little bit of concussion literature. And most of the concussion literature is geared around looking at physical function or cognitive function following concussion, either in the recovery phase, the testing phase, early testing diagnostics, or the later return to sport. And today, it looks like Tyler picked one that's kind of combining the two and seeing, does activity that focuses on working on our functional ability have any influence on our cognitive demand and our cognitive ability? So, Tyler, take a second and just let us know, what was the actual article, the title of the article that you chose?
Yeah, so the title of this article is Sub-symptom Threshold Aerobic Exercise Improves Executive Function During the Early Stage of Sport-Related Concussion Recovery.
Perfect. So we are trying to see, does getting somebody working aerobically improve their executive function in this early stage of concussion rehab? Talk to us a little bit about the background of the study. So, why was this set up? What were they hoping to find? And then ultimately, what did that design look like?
Yeah, so some of the older concussion research had rest and recovery as a mainstay of people's rehab. However, newer research suggests that by inducing a symptom threshold aerobic activity, this may actually progress our athletes faster and aid in that recovery process. So not necessarily leaning into that rest and recovery part too heavily. In this study, they sought to see if a single bout of sub-symptom aerobic exercise had any effect on executive function in the early stages of concussion rehab. So as far as our experiment group here, we had 32 participants, all about college age. We had one group which was in a sport-related concussion group. They were all varsity athletes at the University of Western Ontario, 5 of which were female, 16 participants total in that group. And then we also had another healthy control group of 16 college-age non-athletes necessarily, and also including 5 females in that cohort as well.
Perfect. And the concussion group, it looks like all of them were less than 2 weeks out from the concussion, so somewhere in that 3 to 14 day range.
Correct.
Perfect. And then what did they end up doing with this group? We've got 2 groups, healthy control group. We've got our concussion group, 16 are in each. We've got high school aged individuals here. What were they actually doing for the methods or the clinical design of this? Sure.
So there were kind of a few different parts to this study. So there was an exercise intervention part, and then an oculomotor and a symptom assessment phase in each of these cohort or in each of these groups. So as far as our exercise interventions that were performed in our sport-related concussion group, so again, those people who had just had a concussion within 3 to 14 days, they showed up for their first visit about 4 to 13 days post-injury. And they completed the Buffalo Concussion Bike Test to determine a symptom threshold heart rate. So basically, the athlete stepped on the bike, they completed this Buffalo Concussion Bike Test, and the test was terminated if their visual analog scale symptoms were exacerbated by greater than 3 points, or if they reached a point of voluntary exhaustion, so RPE greater than 17. If neither of those criteria were met to cut off the test, then they were just cut off at a 30-minute time point. So that group, our sub-symptom threshold heart rate is established. Then there's a 1 to 4 day gap between visits 1 and visits 2 for this group. In visit 2, the participants completed a 20-minute single bout of sub-symptom threshold aerobic exercise, which they determined as 80% of that heart rate threshold from visit 1. In our healthy control group, they only had 1 visit requirement, and they were age and sex matched to a participant in the concussion group, and they were asked to complete a single bout of 20 minutes of aerobic exercise at 80% of that HRT value determined by their age and sex matched counterpart. Going into the oculomotor assessment, so participants were given pre and post exercise anti-saccade and pro-saccade tasks to evaluate their executive function via an eye tracking system. So for those of you who are unfamiliar with the terms anti-saccade and pro-saccade, think of pro-saccade as a basic target finding automatic response type test. So you'd have a blank box, a dot would pop up on either the right side or the left side, and you would be trying to track your eyes to the target and hone in on wherever that dot pops up. The anti-saccade involves more of an executive function in which where that dot pops up. So let's say we have our blank canvas, dot pops up on the right side. We are then supposed to cue our eyes away or shift our eyes to the opposite side of the box, so away from where the target is. This is more of an inhibitory control type of task. So again, it requires a bit more of executive function, and this is how the testers determined whether or not the exercise effects were more of a just overall reaction time improvement in cognitive processing, or if this was actual improvement in that inhibitory control or executive function type of metric. And then in regards to our symptom assessment protocol for here, the SCAT-5 was utilized throughout the concussion group's assessment to identify the frequency and intensity of 22 symptoms on a scale of 0 to 6. This was completed before and after the Buffalo concussion bike test on visit 1, before and after the exercise intervention and each ocular motor assessment and visit 2. And then the concussion group also had a third follow-up visit 24 hours after the exercise intervention to see if there were any carryover effects on that symptom assessment profile.
Perfect. So we got a lot going on here. We've got the exercise portion of it where essentially they found what their exercise threshold was, and then they were taken through a workout where they exercised at 80% of that threshold. Then they had their oculomotor assessment, which was an anti-saccade and their ability to identify where a target was and then shift their focus away from that target. And then they had a perceived exertion or a symptom assessment. And the ultimate goal was to see, was doing this bout of exercise going to improve their outcomes on either the oculomotor task or on their symptom assessment or their perceived exertion task. So now that they have run through the trial, Tyler, what do they actually find?
Sure. So first off, looking at the pre and post exercise post-saccade reaction times, they didn't really find a significant variance between the two groups in regards to their reaction time for pro-saccades. However, the important part here is that only in the anti-saccade reaction times did they see a difference pre- and post-exercise. So there was a significant difference in anti-saccade reaction times between groups pre-exercise. And then what we saw post-exercise was that the sport concussion group actually was able to match the control group's reaction times for anti-saccade movements, suggesting that the post-exercise effect on the concussion group was to improve executive function to more of a normal level consistent with our non-concussed control group. Also to note here that none of the athletes who participated in the Buffalo concussion bike test, those who were concussed, all of them were able to complete the test without meeting that permitted level of exertion of 17. and one of them was actually able to complete the entire 30-minute protocol, while none of those athletes reported a visual analog scale increase greater than 3 above baseline. So we saw that this Buffalo concussion bike test, finding that sub-symptom threshold, is a safe intervention that's non-provocative to a concussed athlete if done appropriate or done correctly. Go ahead, Zach.
Yeah, so really like 3 big takeaways from this. Anti-saccade reaction times improved. So their inhibitory control improved after doing the aerobic exercise. We also found that none of the individuals who did the aerobic exercise had an increase in symptoms. So even if you are doing this with the intention of hopefully improving somebody's cognitive function, if that doesn't work, you still know we're able to exercise them aerobically without flaring them up and without having them have a setback. And then to kind of counter-argue that, they did find that people who did the aerobic activity actually saw a reduction in symptoms 24 hours after as well. So when you look at this from a clinical practice, Tyler, and we just kind of highlighted them, but are there any other big takeaways, or does this article serve as affirmation to maybe something that you or your colleagues are already doing well that you want others to take away with them?
For sure. That's kind of like what you were talking about at the beginning of the podcast here, is that we know our athletes are going to have cognitive impairments, and they're going to have some kind of activity intolerance, exercise-based impairments in a lot of our concussion groups. So I think an important point to make here is that regardless of what their significant deficits are, what you find in your eval, that the aerobic component, incorporating some level of aerobic exercise, is going to aid them in progressing their recovery rather than just recommending rest. So if you are a clinician who's not super familiar with concussion rehab, know that what we do well, right, is prescribing exercise. At the very least, prescribing exercise in an appropriate manner that doesn't cause symptoms for your athlete is going to be beneficial for them in the clinic.
Perfect. Well, Tyler, appreciate, as always, diving into the literature, giving us the great summary of it. If you enjoyed this episode, please share, like, and subscribe. You are listening to the Strength and Knowledge Podcast. Dr. Zach Baker and Dr. Tyler Betteridge. Thanks for listening.